Welcome back everyone to session 6 of our virtual shoulder class here at St George's Hospital. Today what we're going to discuss are what are your available management options to managing your rotator cuff related shoulder pain. Initially you may have started out really being quite worried about moving and exercising because of your link with increasing your symptoms, but hopefully at this stage, 6 sessions in of 8, you're starting to see a little bit of return for your money and investment by making your shoulder more resilient, conditioned to do what you want it to do, and therefore noticing an improvement in overall pain levels. The research when it comes to exercise and management of cuff-related pain is really positive, and we found that it's just as effective as surgery, and in some studies it's found to have been even more effective. What we're equally conscious of is that the cuff responds well to graded loading, and also making you globally fitter and stronger will do you no harm at all. And we know that exercise is really well supported in terms of the treatment of a multitude of different comorbidities or health conditions. Certainly strengthening the lower limbs, the trunk, and making the spine more mobile can have a really good impact on your shoulder symptoms. Next, what we should explore is that surgery can have a role to play in management of rotator cuff related shoulder pain, but it's not a big one. A large 2017 trial identified that some of the surgeries that have started to fall out of favour now, which were routinely used for management of symptoms, have really fallen off the radar because they were found no more effective than exercise. But we're equally conscious if you've had a really good shot at your exercises, your symptoms have unfortunately continued to persist, then there of course is an avenue that we can refer you on to an orthopaedic surgeon if it is clinically felt necessary, and that's part of your decision and that of your physiotherapist or any other health professional that you're working under. But let's not overlook the risk factors that are associated with surgical intervention, which you just do not get with other modalities. Equally, injection therapy. You may find that your symptoms are just really irritable. And in this circumstance, we may consider collaboratively an injection at this stage to give us a window of opportunity to allow you to participate in, guess what? Your exercise. And this can be organised through primary or secondary care. Equally, medication. Medication is an important piece of this puzzle, and it shouldn't be looked at as something to completely mask your shoulder symptoms, but something that allows you to participate in exercise again. Whether it is simple over-the-counter pain relief or other modalities like hot and cold, and this can be something that you can discuss with your GP or pharmacist if it's something you don't already use. Thank you for listening in today to session 6 of our virtual shoulder class, and we look forward to seeing you again for session 7, where we discuss flare-ups.